Today, we are diving into a topic that might surprise you: what your feet can potentially signal about the health of your liver. Now, it's crucial to remember that this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. So, why the feet? Well, our feet are the foundation of our body, and they can sometimes show the first subtle signs of systemic issues. When a vital organ like the liver isn't functioning optimally, it can affect circulation, fluid balance, and nutrient absorption, and some of these changes can manifest all the way down in our feet. Let's explore some of these potential signs, keeping in mind that they can have many different causes. First up is swelling, also known as edema. Have you ever noticed your ankles or feet looking puffier than usual, especially at the end of the day? If you press a finger into the swollen area and it leaves a temporary indent, that's called pitting edema. While this can happen for many reasons, like standing too long or a high-salt meal, persistent or worsening swelling could be a sign that your body is having trouble managing fluids. A compromised liver can struggle to produce enough of a protein called albumin, which helps keep fluid in your blood vessels. Without enough albumin, fluid can leak into surrounding tissues, often pooling in the lowest parts of the body due to gravity. Your feet and ankles. Next, let's talk about itching. We all get itchy feet now and then, maybe from dry skin or an insect bite. But what if you have a persistent, intense itch on the soles of your feet that just won't go away, even without a visible rash? In some cases of liver disease, bile products that are normally processed by the liver can build up in the bloodstream and deposit in the skin, causing a condition known as pruritus. This itching can be particularly bothersome at night and might not respond to typical anti-itch creams. It's a sensation that feels like it's coming from deep within the skin. Another visual clue can be the color of your skin. A yellowish tint to the skin and whites of the eyes, known as jaundice, is a well-known sign of liver problems. This is caused by a buildup of bilirubin, a yellow pigment. While it's most noticeable in the eyes, in some cases, the soles of the feet and palms of the hands might also take on a yellowish hue. Again, many things can affect skin color, but a noticeable yellowing is something to discuss with a doctor. Have you ever noticed tiny web-like clusters of blood vessels on your skin? These are called spider angiomas or spider veins. They have a central red spot with reddish extensions that radiate outwards like a spider's web. While they can be harmless, a sudden appearance of multiple spider angiomas, particularly on the chest, face, or even near the ankles, can sometimes be associated with high estrogen levels that a struggling liver can't properly metabolize. The increased pressure in the veins, a condition called portal hypertension, which can develop with liver issues, may also contribute to the appearance of these tiny veins in the lower legs and feet. Now, let's look at your toenails. Our nails can tell a surprising story about our overall health. If you notice your toenails have become unusually brittle, are breaking easily, or have developed prominent vertical or horizontal ridges, it could signal a nutritional deficiency. The liver plays a key role in processing and storing many essential vitamins and minerals, like iron and B vitamins. When liver function is impaired, it can lead to malabsorption, and your nails might be one of the first places to show it. Another sign, though less common, is Terry's nails, where most of the nail appears white with a narrow pink or brown band at the tip. Finally, let's touch on muscle cramps and fatigue. Do you often get unexplained, painful cramps in your feet or calves, especially at night? While dehydration and electrolyte imbalances are common culprits, chronic liver conditions can also disrupt the body's balance of fluids and minerals like calcium and magnesium, leading to more frequent muscle cramping. Paired with a general sense of fatigue in your legs and feet that feels disproportionate to your activity level, it could suggest that your body's energy factory, the liver, isn't running at full capacity. It's important to see the bigger picture. One of these signs on its own, like occasional swelling after a long flight, is likely not a cause for alarm. The context is everything. However, there are certain red flags that should prompt you to seek medical evaluation right away. These include a sudden onset of severe swelling in both feet, especially if it's accompanied by abdominal bloating or shortness of breath. Also, persistent and noticeable yellowing of the skin or eyes, or finding that you are bruising or bleeding very easily, are significant signs that warrant a prompt visit to your doctor. Never try to self-diagnose based on information you find online. So, what can we do to support both our foot health and our liver health? The good news is that the core principles are the same ones that benefit your entire body. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides the nutrients your liver needs to function and helps maintain a healthy weight, reducing stress on your feet. Limiting alcohol consumption is one of the single best things you can do for your liver. Staying active with regular exercise like walking, swimming, or cycling improves circulation to your feet and supports overall metabolic health. Protect your feet by wearing comfortable, well-fitting shoes, and inspect them regularly for any changes, especially if you have other health conditions like diabetes. And most importantly, schedule regular checkups with your healthcare provider. Routine blood tests can monitor your liver function and catch potential issues early, often before any symptoms even appear. If you have any of the concerns we've discussed today, please don't hesitate to bring them up with a qualified clinician. They are your best resource for accurate diagnosis and personalized care. We hope this discussion has been insightful, helping you connect the dots between different parts of your body. Remember, your body often sends signals, and learning to listen to them is a powerful step toward proactive health management. Thank you so much for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more content that empowers you on your wellness journey. Stay safe, stay informed, and we'll see you in the next video.